We are now streaming live.
Thank you, sir. Chairman.
Yes, how everybody doing? Good morning to the members that were able to join us for today's committee of the whole. We're holding today's regular scheduled committee meeting a little differently today. We wanted to try to combine the three committees as one. We are fortunate to have two new board members who are the representatives of Chatham County elected county commissioners for District 3 and 8. We have Commissioner Lockett serving District 3 and Commissioner Adams serving District 8. I appreciate and thank both for joining the CAT Board of Directors. I look forward to working with each of you as we look forward in governing our roles as government and our responsibilities. Also would like to thank our outgoing members, Jay Jones and Tabitha Adele, for their outstanding years of public service to transit and also around the communities. Moving down the agenda, I see that we have COVID-19 presentation from the Department of Public Health. I would like to turn the floor over to Mrs. Molden, and she can introduce to you Dr. Lawton to the committee. Ms. Molden, the floor is yours.
All right. Thank you, Mr. Chairman, and good morning again, and Happy New Year to everyone that I have not spoken to. We're excited to have Dr. Lawton Davis here with the Coastal Health District. As you all know, COVID-19 has impacted every aspect of life. During COVID, Chatham Area Transit has continued to offer services, and the essential employees of Chatham Area Transit that are on the front line every day, interacting with people from all walks of life. We want to make sure that we are doing everything we can to protect our essential employees. And as a part of that, I think it's very important for the board to begin the process of discussing the vaccine, the impact of it, whether or not employees should or could be required to get the vaccine and all of that. But I think as establishing a baseline, it's important to understand where we are as a county in terms of COVID so that the board can make an informed decision. And so I met with Dr. Davis, my team met with Dr. Davis last week, and we had a wonderful discussion just about the impact of COVID, as well as what they are doing in terms of their employees. And so I asked Dr. Davis to come and share with the board the information that he has so that we can hopefully begin a dialogue about how we want to proceed when we, as an industry or as an agency, come up on the list, which I think we probably are in the next group after this ginormous group that I think they're working with right now. So with that being said, I'm going to turn it over to Dr. Davis. Thank you so much for being with us this morning.
Thank you, and thanks for the service you provide. I'll make a few comments and then try to take questions because I'm not sure that I'll hit exactly what you want to hear. But as you know, COVID in our community is on the rise, just like it is elsewhere in Georgia and in the United States. We've seen a significant increase beginning around Thanksgiving, and that is pretty much what I think all of the national public health experts sort of expected, Thanksgiving being the perfect definition of what we would call a super spreader event, meaning people get together, they gather, they're indoors. A lot of times it's just family, but it's family from somewhere else, and you're sharing community air. So we saw an increase after Thanksgiving, and the peak of that increase, unfortunately, fell right about the same time people began doing the same thing for Christmas. And then a week after Christmas, we had New Year's Eve and celebrations and et cetera. And all of those things, I think, have conspired to significantly increase the burden of spread in our little slice of paradise here in Chatham County. I'm going to see if I can share a screen here. I usually can manage to do that, but sometimes I don't do so well. Do you see some charts there now? Oh, wait a minute, share. Hopefully you see a chart here. This basically just looks like blue lines.
We can see it.
Yeah, this particular chart represents what we call the 14-day community transmission index, and that is the same thing that the governor chose as his metric to allow communities who chose to do so to adopt a mask ordinance, and he would fuss at them for doing so. The threshold that he set is 100, which is down here where our peak was back in the summer at 621. And as of this morning, we're back up to 553. So we're 5.5 times above the minimum threshold that the governor set to allow a mask ordinance. This next chart that looks very similar is a different metric, and the significance of this one is that it's put out by the Harvard Global Health Institute or something like that. And the significance of it is that when early on during the pandemic in Europe, when communities went to reopen schools, if this particular measurement was less than 1, obviously it was really good because that basically meant there was no COVID-19 in their community. If it was less than 10, they did so-so or did okay. If it was less than 15 or 20, they did so-so maybe. And then if it was above 25, they did really bad. And as of this morning, we're at 44.4. And it's equally important to note the slope of the curves as it is the absolute value of the curves. I mean, we're going almost straight up on this thing and on the other one. Not sure how to make this a whole lot bigger. Maybe I can. This orange, gold, whatever it appears on the screen line is the 7-day moving or rolling average of new cases reported in Chatham County over the past week. So I simply take the number of cases that reported each day, add them up and divide by 7. And you can see we're at almost at 130 now, and our peak back in late July was 136. So again, it's just another indication that we have almost reached our maximum level. And then this last chart that we look at is the percentage of tests performed for COVID-19 in Chatham County, not just through public health, but any providers. And at the federal level, they consider any percentage above 10 to be the red zone or really bad. And again, you can see that we basically hit 10 back here on December the 2nd. That's 9.8. And we've been pretty steadily rising. All right, let me see if I can get back, figure out how to unshare my screen. I'm not sure I'm smart enough to do that all of a sudden. Where did it go? Huh. I may have to get some help in here. I'm not sure how to get back to the main thing so that I can.
Are you trying to unshare your screen, Dr. Davis?
Yes, ma'am.
All right. When you click on the share screen, it should be a prompt there to.
Oh, I'm sorry. I've got one of these new, I'm not used to it yet. I've got this fancy thing now that lets me have 2 screens. And I was looking at the wrong screen. So should be back to me now. Are you back to me?
Yes.
Okay. So as a community, we're definitely seeing an increase in the rate of community transmission and the burden of the virus in our community right now, we're basically back to summertime levels. As far as the vaccine goes, as you know, we were fortunate to receive some of the first, actually the first doses in Georgia came right here to Chatham County. I'd like to tell you that's because I'm such a wonderful guy, but that would be a lie. I think it had to do more, you know, in real estate, they say location, location, location. And I'm sure the federal program was also trying to get vaccine down to Florida. We happen to be right on I-95 between Washington and Florida, and we had an ultra low temperature freezer. So, you know, voila, we got it. But we've been vaccinating ever since we got our first dose. We have supplies of both vaccines, Moderna and Pfizer. Just briefly, you know, we're probably cranking out somewhere between 600 and 700 vaccinations a day. Just in the health department, we've shared our vaccine with hospitals, other practices, and trying to get as many people involved in the vaccination process as we can, because public health can't vaccinate everybody that needs vaccinating in Chatham County. Keep in mind that every time we give one vaccine, that means we have to save a slot to give another dose of vaccine, because everybody has to have their second dose, which, if you just think about it for half a second, you'll realize that decreases the total throughput of new vaccinations by 50%. But we are vaccinating, and I know that there are a couple of large scale organizations that are going to come online and be vaccinating in Chatham County either this week or next week, as the case may be. So we can't be the only game in town doing this. We need a lot of other people doing it as well. If you look on our website, there's a place you can click and you can see a list of other providers in Chatham County aside from public health who have the vaccine and who are willing to be publicly identified as having the vaccine. You know, not everybody wants it out there because they'll be inundated as we have. We're already booked out until March. We still have approximately 1,000 people on a callback list schedule. And so if you look on our site, it'll tell you that we have temporarily paused in our scheduling of new appointments, and that is true. You know, I mean, we don't even know that we'll still have vaccine at that point in time to administer. So we're setting up a process where people can enroll, and as soon as we are able to begin scheduling again, we will notify them to, sign up. It is not a site to go to schedule a vaccination. It is currently a site, sort of a holding pen, if you will, if you're used to hosting meetings, where we're going to come back to this as soon as we can. We're working with several other organizations to increase our capability. We've got medical students assisting us. We're exploring a couple of other large industries to assist, and some community locations. We're working with a couple of other partners to reach to some of our low income neighborhoods where people are less mobile and maybe can't get to us. We're going to try to go to them. That'll be rolling out either later this week or early next week, and also to reach the homeless population. Again, it's going to take way more than just public health doing this. We simply are not funded or staffed at the level where we can vaccinate everybody in group 1A+ in Chatham County. And I guess I'll hush there and try to answer questions.
Dr. Davis, will you discuss where you understand transit falls in terms of priority?
I believe you're in 1B, which will be the next group. The next rollout, you would be critical infrastructure. And I certainly agree with that. People can't get to work, they can't work. And if our drivers and other workers in that industry are not protected, then they can't work either. So I can't tell you when we're going to get to 1B. If they truly wait until we finish 1A+, it'll probably be at least 2 months. If there is a change at the top, if the governor's team decides to go ahead and allow access to that group as well, if they think we have enough vaccine, and I'll come back to that comment in just a minute because it may get better shortly. It may come sooner than that. There are 2 other vaccines that are in phase 3 trials, and my understanding is that one of those is going to submit an EUA similar to what Pfizer and Moderna have done by the end of this month. And if that is approved, which we anticipate it will be, that vaccine is actually a single dose vaccination, which, would just be tremendous. And I think there would be an abundant supply of that vaccine as well.
I have a question.
Yes, ma'am.
And this is only because I've been asked this by numerous people. When you have someone in your family that you have to take to the emergency room and they test positive for COVID, people are told to go home and quarantine. They're not given any instructions about when an appropriate time is for them to be tested, how long should they quarantine. Is there a way to administer just a handout sheet from emergency rooms or these facilities where people are tested and do come up tested positive to help the family members know what to do next?
Sure, and I think that information is actually available on our website, and if people call and if that family member is enrolled as a confirmed, as a case, and we know about it, we actually attempt to contact all of those people and then discuss the quarantine issues.
Well, what I'm hearing is that you have elderly people that may or may not have access to a computer.
Right.
And they're leaving the hospital. Of course, they're in shock. They don't know what comes next, and they don't know what they're supposed to do. And I just thought a simple 1-page handout that would include a number for you all, the website, just to help guide people and give them some comfort. I think because there's some real confusion as to how long do they wait before they're tested? How long is the actual quarantine for? So it just seems a little unfair to turn family members loose. And in the case of the 2 family members that I spoke with, neither of them received any follow-up.
Okay. I'm sorry they haven't had follow-up. It probably means that the case has not been reported to us. We can't, and we don't even follow up just on a hearsay case, but we would share information. I've made myself a note to try to get the handout out.
Okay, well, this one was through St. Joe's emergency room,
Yeah.
and they were just dismissed. I mean, sorry, your loved one has COVID. We're admitting them. See you later, kind of thing.
I understand.
And that I think adds to the fear.
Sure, I don't doubt it. To discuss that for a minute, if let's say you're the primary caregiver of somebody who has it and they have to go home and you're going to, constantly be around them because you're taking care of them, they have an isolation period. Isolation is when you actually have the disease. And so they would be in isolation for at least 10 days from the date of symptom onset and until they become afebrile. The caregiver, unfortunately, is being potentially exposed every day. So his or her quarantine period does not begin until the sick family member's isolation period ends. And then, the preferred method is still the 14 days of quarantine. And if that family member remains asymptomatic, we would still encourage them to have a test somewhere around the 8th to 10th day of quarantine.
Well, because see, the initial gut reaction is, oh, let me go get tested right now.
Right.
And I don't think that that's the way it makes sense. So I'm just telling you that there's a lot of confusion out there. And I think that just a one-page handout or a card or something to help guide people would be very helpful.
Again, I have made myself a note here to try to make sure we have that in the emergency rooms so that they can hand it out.
Okay. And I guess the other question is, I'm receiving some complaints of people that get the vaccine, and they're saying that if you all had, I guess, worked through like military hospital, I mean, what could we do to help expedite people getting their vaccines?
I'm not sure I heard everything that you said, but the biggest thing that will help expedite people getting their vaccines is having more providers in the community sign up to be vaccine providers. There's a physical limit to the number of people we can put through in the health department, because you can only bring a certain number into the lobby safely, and you also have to watch people for 15 minutes after they have received the vaccination. So that causes crowding. So
they actually have to sign up to be a distributor of the vaccine?
Oh yeah, and that's been available for weeks and weeks.
Okay. No, I'm asking questions based on the emails that I've received.
Sure. Yes, and if anybody is interested in doing that, they again can go to our website, and there's a place where it says providers who want to enroll, click here, and all the information on how to do it is there. We're not the ones that enroll them, but we've got the information there for anybody who wants to do that.
Thank you very much.
You're welcome. And if you have any sway over anybody and you can persuade them to sign up to be a provider, that is fabulous.
I'm gonna work on it.
All right, Dr. O'Halloran, I recognize you had your hand up.
Thanks, and great information, Dr. Davis. And congrats to our commissioners who approved that deep freezer for the health department where we can actually store those vaccines. Are we seeing any kind of reluctance from the healthcare workers to get their shots in Chatham County?
The short answer is yes. The actual primary providers themselves, the doctors, and nurses and dentists have been a little better about taking it. But when you go to the staff that's associated with them, there is a good bit of what we call, affectionately called vaccine hesitancy or reluctance. Yes. I will say that based on our phone calls and demand, the level of hesitancy among those 65 and over is much less. The elderly population is ready to get the vaccine.
We're so used to getting shots, I don't think it's ever a question mark. Are we seeing any of that English variant, the B117 in Chatham, or is that just specific parts of Georgia? I cannot test specifically for that one. Yeah.
The standard, PCR or rapid screen, antigen screen will say, yes, you have COVID-19, but it won't
give you a strain yet.
It won't discriminate. And I see absolutely no reason to expect that we won't have it, and we may well already have it. Yeah. I mean, if it's even more transmissible than the original strain, so to speak, or strains, then yeah, if it's not here, it will be soon.
Soon. And it does have the same antigen on it that triggers the vaccine. So at this point, we're assuming it's going to have the same reasonable effectiveness against that new strain and every new strain that comes out after that one, because we know they're notorious for mutating as they go.
I read a study, I think it was Sunday, where this may have come from South Korea, they had done some specific studying on the new the new UK strain, and it does appear that our vaccines are effective. But I guess every time there's a major change, there's just a little bit of uncertainty. But at the moment, the Moderna and Pfizer products seem to be effective for the UK strain and that one that was down in South Africa or wherever it was.
And more good news, and thanks for all the information. And we do appreciate all the work Dr. Toomey did. She was a great voice for the state of Georgia in reference to all that was going on.
Thank you.
Dr. Davis, are you aware of any industries or anyone that is actually all out requiring their employees to take the vaccine?
I'm not aware of it. I've seen, discussions online, not online, but on the news and this, that, and the other. And I've seen it. I've read that most legal experts feel that it is within the right of an employer to require it. We have not required it. And most of the people that I've specifically inquired about that have decided that they're going to strongly recommend but not require, because these things are not your usual vaccine. They are out under an EUA. And that's kind of the route we took.
All right.
Thank you, David. Do we have any more questions from any of the directors?
All right.
Yeah, I've got a quick thing.
All right, I got Leggett, then I got Emister.
Hey, Dr. Davis. This is Dietrich. We're, I work over at Memorial. There's been a lot of apprehension and pushback from multiple employees not to have the vaccine done. But I think there's been some, and I know you probably have seen, but could you talk to us about if there's anybody who has had some apprehension as well as some reactions to the second phase of the vaccinations that they're getting?
Yes. As far as the vaccine hesitancy, I would just say 2 or 3 things. One is that these vaccines were brought to market, so to speak, pretty quickly, but the shortcuts were taken in bypassing the bureaucratic morass, the paperwork and the blah, 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 not in safety and efficacy studies. Now, obviously they can't do a 5 million person phase 3 that quickly, but they did, tens of thousands of people to determine the safety and the efficacy. And it was primarily all of the bureaucratic stuff that got waived by the Operation Warp Speed. And I think that's one thing they did. It was very good. You can cut through the paperwork. That's a good thing. The second thing, I think the vaccines are safe and I think they are effective. The second thing would be to remember that there is no component of the actual virus in either of these vaccines. So it's impossible for them to cause the disease. What the vaccines do is to induce your immune system to make a portion of the spike protein that is present on the COVID virus. So you don't have the inside of the virus, you just got the little spiky things that they use to attach to our cells to get inside of your cells and do their dirty work. So the vaccines actually make some of your cells make spike protein. The rest of your immune system then reacts to that. And so if you ever are then exposed to the real virus, your immune system already recognizes that spike protein, and you have already developed what we call blocking antibodies, little things that stick to those spike proteins and prevent them from sticking to your cells. And so you can't become infected with it. So that's how it works. And the first dose creates a significant response. The second dose is basically to help solidify your immune system's long-term memory. It's kind of like if you were a kid and you got a spanking at school, if your parents were like mine, you were going to get another one when you got home. And that second one didn't really do any good as far as correcting what you did at school, but it certainly made you remember it better not to do it again. So the second dose is really a memory boost for this thing. And you are correct in that side effects from the vaccine in general are worse after the second dose than the first dose. So if you think about it, that makes sense. You're making, an actual imitation of the virus itself. You're reacting to it. You're going to feel like you got the flu or a mild case of COVID, possibly. And with the second dose, since your immune system is already primed, that reaction is going to be more robust. And so you're likely to have a little more fever, a little more joints, a little more muscle aches. You typically don't get the cough and cold and runny nose symptoms. You have more of the musculoskeletal achy stuff and a fever. That's the typical thing. There have been a few people that have had, hives or some other kind of reaction. And sometimes it's impossible to tell if that's anxiety. And, there's some people that'll break out in hives if you just stress them out. So sometimes you can't, I'm serious. And sometimes you don't really know which it is. There have been a very few true anaphylactic reactions, and that's probably to something in the vaccine called PEG or polyethylene glycol. And I mean, that just happens in a very, 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 very few people. And as far as contraindications, people ask a lot of questions about, okay, I'm allergic to peanuts. I've had a bad reaction to peanuts, or I had a bad reaction to shellfish, or I had a bad reaction to ant bites and I have to carry an EpiPen because I'm allergic to ant bites. Those things, there's no cross reactivity. So the only true contraindication to taking the vaccine is having had an allergic reaction, an anaphylactic reaction to a previous dose injectable vaccine or injectable medication. Even women who are pregnant, it's felt to be safe for them, although we advise them to talk to their OBGYNs before we just give it to them. So the vaccines are really, what's in the vaccine itself is really very clean. There's a little bit of sugar, there's a little bit of salt, there's a little bit of water, and there's a little tiny bit of artificially manufactured what's called messenger RNA, which is a little bitty piece of genetic code. There's no part of the virus in it, whatsoever. And that's, I guess, a long-winded answer to a short question. Sorry.
Thank you.
I would ask the question, what's the downfall if you miss the second dose?
Well, don't pass go, don't collect $200, go directly to jail. No, actually, there is a little bit of leeway on the backside. You don't need to get the second dose too early, but if you get it late, it's probably not a problem. All of the efficacy studies were done with 2 doses, not 1 dose. But if you keep up with the news, you know that the UK is taking the position of let's postpone the second dose and give all those potential second doses to more people to get the first dose in. I think what you'll find and what the evidence seems to show is that as long as you get it within, probably a couple of months or so, maybe 3 months, you'll still have a very, very, very effective vaccination.
That makes it kind of like the Shingrix, where the second one had to be given within a short period of time.
Correct.
Boy, that one was painful. I have a feeling I'm going to have the same problem with this one.
Well, Shingrix is not as clean a vaccine, though, so you may not.
Do we have any more questions?
Yeah, somebody, Clinton up there has a hand up, I see.
Yes.
Yeah, I'm sure you've probably conferred with Ms. Malden on this, but I would imagine if you all needed any locations or transportation or a tool for communicating to folks. We're another county department that's moving people around. We come in contact with a lot of folks all the time. I would love to see some collaboration or cooperation between, especially getting information out, and really anything y'all might need right now. I'm not gonna, overstep what I can do, but I think that would be, we're here, I'm here.
And if there's anything you specifically want, to have on hand, if you let us know, we'll try to, get it to you.
Is there any plan for a drive-through vaccination sites?
Yes, we're working on a site, a location, and the logistics. You hear a lot about that online. I know everybody ought to do this and blah, 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 but they're actually on the backside of that. There's equal blowback that may not be the best way to go, in that it's more difficult to assure that you have the right amount of vaccine and you're not wasting vaccine. And then if somebody is sitting in their car and has an anaphylactic reaction, it's much more difficult to get to them. So there's pluses and minuses. So far here, we have done a couple of big Saturday clinics where, instead of running 700 people through or 800 people through a drive-through, we're using fewer people over a longer period of time and running them through our health department. If you do a drive-through, the manpower is very intensive. So there's pluses and minuses, but the short answer to your question is yes, we are planning on, if we are sure we have enough vaccine and we decide to pull the trigger on that. Keep in mind that anytime
Plus enough people to give the shots.
But keep in mind that anytime we do one of these big operations, we're pretty well bound to have another big operation either 3 or 4 weeks later to catch the second doses. And you have to make sure you're going to have the vaccine supply to do that.
Great. Thanks, Dr. Davis.
Thank you. All right. Have any more questions? We got
yes, I have a question.
Director Adam.
Yes, sir. Thank you. Doctor, is there any truth to they're going to be mixing the doses or even giving half doses of the vaccine?
There has been, well, two answers. At the moment, if you get Pfizer for the first dose, you get Pfizer for the second dose. If you get Moderna for the first dose, you get Moderna for the second dose. Since they are extremely similar and they use the exact same technology, that messenger RNA I mentioned, there is some consideration that down the line, when studies are done, it may be okay to mix them. But at the moment, we're not mixing Pfizer and Moderna. There is also discussion about using a smaller dose of the Moderna vaccine in younger adults. Typically, younger folks have their immune system isn't as old as mine. So younger people typically have a better, response. It's kind of like, and there's this theory out there that you only have to stimulate your immune system so much in order to get a good response. If you think about your toilet at home, if you sneak into the bathroom and you very gently press that handle, your toilet flushes. If you run in there and smash that handle with a sledgehammer, your toilet flushes. Didn't matter which way you did it, you got the same response. And to an extent, that's true with your immune system. Once you get above a certain threshold, you get a good response. So they're talking about dropping the dose from 0.5 to 0.3 cc's in younger adults with Moderna, but I haven't seen any definite decision on that.
Thank you.
You have any more questions?
Mr. Chairman?
Yes.
If there are not any more questions about that per se, if you don't mind, I'd like to just recognize Dr. Davis as well for participating in a conversation with our team about how we could safely bring the DOT service back. And so we are in conversation about that. Dr. Davis is engaged with our team, and I just want to publicly express my appreciation to Dr. Davis and his team for working with us through that. And so you'll be getting more. He's given us some preliminary recommendations that we'll be mulling over as a team and taking to the city officials. And so we look forward to reporting back. But I wanted to let you know that we are engaging with Dr. Davis on multiple topics at multiple times. So hopefully this will be the beginning of a wonderful partnership between Chatham Area Transit and the health department.
You know, we've had one, you know, we can't do hurricane evacuation without you. You know that. So you can't run and hide.
Exactly.
Nor do we want to.
All right, I'd like to thank you, Dr. Davis, for that beautiful presentation. If you don't have any more questions, I'd like to move on down to the proposed agenda items.
I'm gonna sign off, Mr. Chair.
All right, thank you, sir. Thank you, Doctor.
Y'all have a good day.
You do the same. All right. Staff has presented 3 proposed items for board consideration and action during our regular board meeting on January 26th. So I'll turn the floor over to Ms. Malden so the departments can introduce each item to us. Thank you.
All right, thank you again, Mr. Chairman. So the first item, item A, is the extension of the COVID-19 emergency measures. We were initially trying to get away from this item. However, as we have encountered a spike in cases locally here in Chatham County, it has impacted our agency directly. And we are requesting to reintroduce these emergency measures, which just allows agency leadership to take steps necessary to secure our facilities, take care of our employees, and make pressing decisions that will impact how we are able to operate as an agency due to the emergency nature of the spikes that we're seeing in COVID.
Comment on that. And that 14% positivity rate is extremely high. Most of the thresholds are at a much lower number. So our cases are in a very bad trend in Chatham County.
So our agency has been impacted directly. We've had departments that have had multiple employees. So we've had to make on-the-spot decisions, even about work schedules, all of that. And so just in order to be able to keep running as an organization. And that is item A.
Gotcha.
If there are no questions, I'll move on to item B.
I do have a question.
Sure.
I'm assuming we're talking about extending the COVID, giving you more leeway to continue COVID, whatever. My question was, and it was a question in the chat box when the doctor was talking, will CAT be mandating that their employees take the shot?
Well, that's a board level. That would be a board level decision.
Okay.
Which is why I wanted Dr. Davis to at least come and brief the board about where we are as a county in terms of COVID cases, what they're seeing in terms of what other entities are doing. And so, of course, and because it's a board level decision, we don't have a recommendation one way or the other. This was simply just to start the discussion. I am in touch with other agencies. I don't know of any other agencies that are requiring that their employees take the vaccine. They're strongly recommending. But again, knowledge is power. And so we're just trying to put as much information as we can in front of you all. But that's definitely a board decision.
Thank you.
And that's going to have legal ramifications because there's not much you can force people to do in this country. And they can't even get healthcare workers to be fully compliant. I don't know if we're going to have much luck at any other level. And
Right.
I'm sure there'll be some kind of legal opinion on this very soon as it comes to that point on mandating. They couldn't even mandate masks. I imagine vaccines are way down on the list of what we can do.
Well, if it is the will of the board, of course, not to mandate it, what we can try to do is set up almost like a community health fair type situation where those who would like to take the vaccine will take it, can take it. We'll try to make it as easy and as accessible as possible when our time comes up. I mean, that's definitely something we can do in the alternative. Just to try to encourage people to get the vaccine, because a lot of people may get it if it's accessible, as opposed to if you leave it up to them to go on their own to a doctor and get it. So, that's something that we can try to, continue to partner with the health department on and discuss those options. But we're, again, just wanting to put as much information in front of you all as possible about it. I think Alderman Leggett, you had your...
Yeah. Yes, ma'am. My question to you is the different agencies who are doing COVID testing. Once an individual is positive for COVID and they don't have the symptoms that would make them stay into an institution, they are sent back home. I know in October, November, we put the barriers in place to shelter our drivers, but when individuals get on our bus, are we requiring them to wear masks, or do we have masks and PPE put in place for them?
We're not mandating it. And the only reason why we're not mandating it is just that we're not trying to put our operators into an enforcement posture because we don't have the security reinforcements to back up the operators if they were to take that stand. And, people get real emotional when it comes to making them wear a mask or not. But what we have done in the alternative is we have really, really stepped up our communication in that regard. If you notice, the headway lights on all of our buses talk about, wearing a mask can save a life. And so we've put that on the headways. We've increased signage on our buses. We're reinforcing those talking points with our operators. And so we're doing everything we can short of mandating that. We're enforcing our social distancing on the buses. We're deploying more buses so that we can meet the demands of various ridership crowds and whatnot so that we can do the social distancing. We are absolutely doing everything short of mandating just to make sure, because, COVID has not only impacted several of us, current company included, directly. I mean, we've now had an operator to pass away due to the, complications of COVID. And so it is something that has really hit home with us at CAT. And we want to do everything that we can to let our operators know that we value their safety and welfare, and that we also value the safety and welfare of our customers as well.
And the reason I ask is because, the 27 and the 28 Waters Road is one of our highest ridden bus lines. And, and it goes to Memorial Hospital. So people who doesn't have vehicles, they utilize transit to leave the hospital with their families. And I just want to make sure that we had that at least on our radar when we deal with people leaving.
Well, thank you for putting that on our radar. And we will talk, with the operators that are on those routes. But again, we're not really in a posture where we can just force people to wear masks, but we will definitely, bearing in mind that that's coming from Memorial, there may be things that we can do to put even more signage out, even more awareness. And so COVID was something that hit all of us by surprise, no real playbook to go by. And so we're just kind of feeling our way through this pandemic, trying things. If it doesn't work, we try something else. And so we'll definitely continue to take that under advisement as we continue to evolve in how we're communicating and how we're, getting our customers to wear a mask and do things that are going to keep themselves safe, as well as our employees and other customers.
Thank you.
Director Adams. Director Adams got his hand up.
Yes. Yes. You said you don't really have the staff to back up the drivers. can you call in Chatham County Police or Savannah Police to back them up if they have an incident where someone won't wear a mask?
We have been told really that the law enforcement is not even staffed to adequately back us up, even if, you know, because of all the other things that they're dealing with. We have not really we've not really been in a position where law enforcement has been able to be responsive to those types of inquiries, just because of all the other things that they're strapped with dealing with. So unfortunately, you know, because we don't have transit police like other agencies, enforcement really is it's almost like a self-enforcement. And so, and our security, which we will be reevaluating and completely revamping the security that we have, just in light of recent events and the world that we're in, we're just really not at a place where we can handle that enforcement. There have been instances where operators, you know, not necessarily about masks, but just about other things, when they've tried to enforce rules on vehicles, they've been in harm's way or put in harm's way. And we as an agency just really don't want to put them in that posture for their safety as well as for the safety of our riders. But I was gonna say, but let me say this also, we are definitely open to partnering with our law enforcement partners. But I think right now, just due to the nature of all that we're all dealing with COVID, I think everybody's short right now. So we just have to kind of lock arms and work through it together.
I think that if we, maybe we consider discounting those that wear masks, you know, maybe that'll boost the morale up for everybody to be responsible if they think that we giving them a discount.
You're cutting into the revenue, which we were talking about, you know, not collecting enough fares. So I don't know how that would help our bottom line.
Well, let us take a look at it as a staff and come back and you know, see if that's a feasible recommendation. I think, you know, COVID again is something we're all we don't have a rule book or a playbook to study. So I think anything we can do to be creative and come up with something that's going to incentivize people to wear masks and be safe, I'm all for it. Let's look at it. So we'll come back, Mr. Chairman, if you like.
Yes.
We'll come back and take a look at it and let you know if that would be feasible.
All right, I appreciate it. Do you have any more questions?
All right, if there are no other questions, then item B, I'm going to call Mr. Cooksey to speak to. This is the paratransit and support vehicle purchase. If you recall, we do have grant funds that were secured specifically for this purpose. And then I'm going to turn it over to Mr. Cooksey to continue with that item.
Yes, good morning. Actually, we are in the position where we need to really turn over our fleet on our paratransit side. So we currently have 33 paratransit vehicles that are slated to come in possibly this year, half, and then half next year. We're looking closely at that as well because the cost continues to rise. So we may bring all those in this particular year. We have a lot of older vehicles on the para side that need to be turned over. So this is a great opportunity to get that done, to bring those vehicles up to date. And if you're looking at really an 80% of that purchase is federal grant and then 20% match by the SPLOS funds. So that would actually be a big lift for us on the para side to bring that fleet up to date. In reference to support vehicles, so we have 21 total. So we're looking for 8, and we really need to make the change on those vehicles. We're looking to expand our footprint, in Chatham County. Eventually, the goal is to put more road supervisors on the streets, to kind of break it out in zones. So we do need more vehicles for that. This is a great opportunity to do that. So these are things that, we have several vehicles from 2009, 2008, that it's time to turn over the fleet in that area, upgrade those vehicles. So That's why we're proposing the 33 paratransit vehicles and the 8 support vehicles moving forward. So I'm open for any questions about, what that looks like or anything additional on top of that.
Mr. Cooksey, I got a couple questions.
Yes.
What happens to the support vehicles that will be offloading? Actually, what happens to any vehicle that we offload?
Yeah, we're looking to either auction those off. I believe on our maintenance side, they have some individuals that they contact. They come out and look at our vehicles and of what's left and purchase those vehicles. So they will get use elsewhere.
And that's a revenue
Yes.
generator a little
Yes.
bit.
Yes, exactly. That's correct.
And
But
you said
that will be brought back to the board in an item though, later
Yes.
on. Down the
Yes.
got it.
Yeah.
Then you
That's
also
correct.
said that we are looking to purchase 33 paratransit vehicles. And how can you talk about what our paratransit fleet looks like currently? And are we expanding it or are we replacing it?
Hey, a combination of
That's
both.
all.
No worries. A combination of the two. We do have a handful of vehicles. I don't have the number right off the top that'll need to be retired that have reached their useful life. So there will be an expansion of what we have, but also we're replacing stuff that really should be off the road that we currently struggle to keep running and for all sakes not running at all. So it's a combination of the two things there.
Dr. O'Halloran?
Yeah, I think there we go. I think when we originally discussed the purchasing, we were looking at adding 18 to the fleet and a replacement of 17. I'm not positive where that actual number breakdown was. My other question on these vehicle replacements, are there plans, since the infrastructure is in place, for any of these to be electric vehicles?
You know what we found in inquiring about on the para vehicle, the technology just isn't there to electrify the para vehicles. And still most are using gas at this time. That is something I inquired about. It may be just the load, the stop and go, just the load, the amount of time that you can probably leave it out on the street. So the additional power that you need for the lifts and everything and added together, that just hasn't been shored up. To go back to your other number, you're correct. I mean, it's a total of 33. I think initially the thought was 17 or 18 to split up the actual order because it's been kind of sitting out here for a while. So we're just into this year on that. So the goal was a split order, but what we're finding is the cost. The longer we wait, it goes up because they're going to be putting them on new chassis. So we just got to make the call is to really just go ahead. For cost savings is to get them all now or have them. They'll start rolling in. They won't come all at once, just to save cost. And then you start retiring out the other vehicles. So as you kind of flipping them over as they come in. So.
Yeah, I know we had quite a problem with the lifts on that last order we had through. Is this through the state again to purchase?
Yes.
Okay, because we're going to have to keep track on those lifts because they cost us 3 or 4 months last time when we ordered because they said the lift was no good and it wasn't no good, it was good. And
Right.
It took us a while to find out that they were holding them for no apparent reason. But I know we have much better technology in car electric. I mean, I would like to see us make some effort to add a couple of electrics to these other vehicles. I don't think it's a cost difference that's dramatic.
Right.
I know with the full-size buses, when we did the evaluation, the cost per year is actually quite a bit higher than gas and diesel and hybrids. And we don't know if that's a long-term solution because the cost is like 35% more and the lifespan is much shorter.
Right, that's correct.
We're looking at a net sum loss actually on going to full electrics on the bigger buses.
Right. Yeah, we can take another look at what's coming in the pipeline as far as electric for para vehicles and see if I can get some type of an answer of what we're looking at for the future, for that type of vehicle or when it'll be road ready.
Yeah, and the battery technology gets better like every other day. There's a new battery with better life and a lot of other things, but We got infrastructure. We can use it. We'd love, be a
Lane,
good
let's
idea.
get class. Now,
That's correct. Yes, sir.
Dr. Robinson.
Thank you.
yeah, I have a couple of questions. With Mr. Lenny, when you first started talking, if I misunderstood, you said we do 33 this year, anticipating doing some more buses next year?
No, that's good. I probably didn't say that correctly. We're slated for 33. We have the option of purchasing all 33 this year. So if we do that, there will be no buses for next year.
Okay. The other thing was, when we talk about ridership decreasing or increasing or whatever on paratransit, do we anticipate increasing ridership and that's why we need 33 buses, or just, just the need to replace old buses that are currently running?
That's correct. It's a need to replace old buses. Paratransit has, declined, but not as heavy as on our fixed route. So we do anticipate it bouncing back, even quicker. But it's a replacement of just old vehicles that need to be retired out. So that's correct.
Then my last question is about the 80/20.
Yes.
Cost. Now, what about insurance? Because the newer the vehicle, the old ones may just be getting liability.
That's correct.
Full coverage. So how would that impact us financially when it comes to our insurance?
Yeah, if you don't mind, David, are you online? Because we actually took a look at this and discussed this.
I'm here.
Yes.
So we took a look at our current policy, and basically what we figured out is that our policy doesn't change. So we currently pay about $7,500 for a bus, about $5,300 for a paratransit vehicle, and about $3,900 for an admin vehicle. And it doesn't seem to change whether we're paying the same for, I could see a 2010 and a 2019. So it's more, it appears that the insurance company looks more about the liability of the person driving and what you're driving versus what the vehicle really is. The property itself doesn't seem to impact the cost that much. So for the replacement vehicles, it essentially would be a net zero. It would be, just replacing what we have, and it would be the same. It looks like it would be the same cost. And then, the little bit you would add for any sort of additional vehicles would probably fall in line with that. That's with the caveat of, with insurance, you never know until you fully sign. But in looking at the entire list of all of our vehicles, each one is in that category and has that premium.
Yeah, and right after we get these, we'll probably be going through our insurance review for the end of year, because that happens about April, May, and that's about when these new vehicles will be coming in. So we'll be able to get a better play on that when we actually have the vehicles and we get reevaluated on our annual basis.
Right. And for the benefit of our new board members, Mr. Cooksey is the Chief Operations Officer, and David Stearns is the Chief Administrative Officer, for the benefit of our new board members. So, Vice Chairman Edminster.
Mr. Cooksey, it sounded like you were wondering whether we should buy all of them now, or some now, some later, which saves us more money.
Well, I think purchasing them now, it would save us more money, because we wouldn't incur any type of cost increase.
But it is more money.
Yes, it's more. Initially, it's the same amount, because we're spending the same over the 2-year period. So it's not more in that sense, but it's more initially, because we would purchase them all under 1 year.
And it's all grant money. It's not any money from CAT.
Right. It's not any money from CAT. That's correct.
What do you guys expect to present to us? All of them or half?
All.
Okay.
Yes. I was just giving you the option of, we can look at all or kind of, initially this was supposed to come up last year. So the thought was we have, already had this in process, half and half, but being that we're here now, it makes sense in us digging as well on the chassis potential increases is to move forward with all.
We have the capacity. Let's do it.
All right.
Thank you.
You're welcome.
And I have one last question on the admin vehicles.
Yes.
I wasn't clear. when you say admin, who would actually be riding those new vehicles?
Yeah, when I said admin, it's more like our utilities, our shop, the road supervisors. They're considered administrative employees. So that's why I just use the overall term admin, but it's really the entire organization. On the marine side, they like to have a pickup truck assigned. So it's really across the board of the organization.
I got a question. How many revenue vehicles are we allowed to have stored on CAT property?
As many, I don't know that there is a cap in terms of how many vehicles we can have. It's just a matter of how many. Yeah. Go ahead, Mr. Cooksey.
No, I say it's more of what we can fit.
Right.
And that is something that we are working through now with the new vehicles coming in, on just looking at our lot to kind of figure out how to park them and what we can actually fit on board. Now, remember, some of this stuff will be rolling out, so yeah, that's more of what we can fit as opposed to how many. Yeah.
How many can we fit presently?
We can get, yeah, you know what? I'll need to confirm that number. I can get that number for you of what we can fit on. What we currently fit at this moment. I know where the vehicles coming in will put us at capacity, so I'll have to confirm that number.
And we'll confirm it, and we'll have it. We'll get that number back to you. But I was saving this. I'm going to save this item for. Hopefully, we'll have a retreat in the future. But one of the things, if we have a retreat, one of the things that I would like to talk to the board about are just our capital needs. Truth be told, we are out of space in terms of vehicle storage. There are things that we need to do in terms of our office space even. And with COVID coming online, once upon a time, it was a thing, this big open air space. Everybody can just work out in the open. Now that we're in COVID, not so much. So it requires that you think about space planning. And so we have a lot of space planning that we need to do as an organization. We have a lot of asset management planning that we need to do in terms of where we store our assets. With the grant money that we have and with the grant money that we're fighting for and have the opportunity to have access for, this organization has an opportunity to make some bold moves in terms of how, where and how we store our assets. Do we want to break off and have a CAT mobility center? Is it time for a new administrative office? Those are questions that I want to put before the board to discuss down the line, so that we can have a strategic direction set out ahead of us, so that as these opportunities come online, whether they be grants or SPLOS or whatever, we already kind of have a checklist to go down of things that we've already kind of vetted and talked about, that you all will have talked about on a board level that fit into the overall vision. So there are definitely some conversations, Mr. Chairman, to be had, because we are at capacity in human capital and as far as our asset ability, our asset storage ability.
All right, thank you.
Any other questions on item B? All right. Well, if there are none, I think, talking about human capital, I think is a great segue into item C, which is a recommendation to pay hazard pay for our collective bargaining eligible employees. Since the beginning of the pandemic, this agency has not paid hazard pay to our collective bargaining employees. Even in the spring when it first happened, the collective bargaining unit employees have been, they have continued to perform. They have not been overly aggressive even in their request for hazard pay. We are proposing to do a one-time $600 payment to all of the collective bargaining eligible employees. And again, it's just a one-time payment. We have to reevaluate our financial situation as it goes forward. So I'm not asking permission to do any type of recurring payment, but just a one-time flat fee payment for our collective bargaining eligible employees. So that would be for our operators as well as for our maintenance staff as well. Dr. O'Halloran.
Yeah, I know we talked about this before. I think it's a good idea. Can you explain how they were paid during the pandemic? And I know there was some overtime pay and some other allocations that were done for those who did actually come in and work on a regular basis, as opposed to those who elected to stay home and not work shifts. And, you know, we went through a lot of chaos about that. And two, how many employees are we talking about? I don't think it's more than 100.
I think it's 100. I think it's 105, and Mr. Cooksey, correct me.
Yeah, I mean, that's a rough number. We can all multiply that out to under $70,000. So we're not, I don't think we're bankrupting the organization if we do decide to go ahead with that.
Mr. Stearns, would you give the exact figures that we calculated?
It's about 190 employees coming out to about 114,000.
Okay.
190, does that assume everybody worked during the pandemic? I don't think we had 100%.
The 190 is the basically the collective bargaining eligible employees. And so the recommendation was to just take all of those current employees that are collective bargaining eligible, and they would receive the one-time payment.
I'm not so sure I agree with that. If they opted to stay home and were given the option of being paid for not participating.
Those employees didn't have an option to stay home.
Right.
All 190 actually did work.
Those 190 did work. Those are bus operators.
Oh, okay, as long as that number's confirmed, then I'm still good with it.
Those are operators. Those are maintenance workers. Those are the employees that are eligible to be a part of the union.
Okay, basically. I thought we had less. We only had about 190 total. I guess it is higher than that. Okay, that's fine. I don't object to the whole plan. I think it's a great idea as long as we understand what happened during those 6 months, and if you can explain how everybody was paid during that time, including admin staff. Okay.
Well, I'm going to preface all of that with there was no playbook that we could go by as an agency in terms of how the agency responded, and that most of this happened before I started. So I'm kind of going on what I was told as well. But it is my understanding that the operators were paid at a rate of time and a half for a period. And I'm not sure of the exact, I think it was from March until June. The operators were paid at a rate of time and a half during that period. And then at June, it was actually ended. And so at June, from the time that it was ended in June, the operators were just paid their regular pay going forward from then until now. It is also my understanding that the administrative and executive staff were sent home on administrative leave at the very beginning, and that they were working on a guaranteed 40 hours a week, but that if they came into the office, that they were able to charge that time as well. And so that, again, that is my understanding for how the COVID pay was administered at the very beginning. But again, all of that stopped in June.
Yeah, I remember that about the administrative, because payroll has to be done in the building. It can't be done remotely. And I was obviously involved in that because I was chairman at the time. And I didn't know it ended in June, but thanks for that information, because I thought it was continuing.
No, it ended in June.
Okay.
When I came on board, in my efforts to kind of assess where we were financially, we stopped all of the additional payments just so that we could get our bearings in terms of where we were financially. And so all of that ceased in June. And so basically our union eligible employees have worked from July until now without any additional hazard pay. And so I really wish that we could do more. But again, we don't know necessarily that another CARES Act is on its way, which I did ask the chairman if I could add that under new business in terms of where we are with that. But our operators deserve it. Our maintenance staff, they deserve it. I mean, they face the elements and are with people from all walks of life every day. And so, and they have been relatively great to work with in terms of supporting the mission of why we're here. And so we want to do everything we can to let them know that we appreciate the work that they do and that they are very, very important to the lifeline of this agency. So, Commissioner Adams.
We got Dr. Robinson.
Oh, I'm sorry, Dr. Robinson. I'm sorry.
Dr. Robinson was first.
Okay. I'm sorry, Dr. Robinson.
I have a couple of questions.
Sure.
The 190, it says has about 190 union eligible employees. Mm-hmm. Do you anticipate more than the 190 or less than? Because the word about kind of concerns me when we're looking at exact figures and how much dollars. Because I do have a dollar question as well.
Sure. No, 190 is the number. We have worked to try to make sure and double check. I think at the time when the reports had to be due, because we have internal deadlines. So at the time that the reporting was due, I think the word about was put in there just to qualify it in case in us doing our math and recalculating everything, we came up with an additional person or two, but nothing catastrophically different than what we've already put before the board.
Okay. And my other question is, when I look at the when I look at the funding source and impact on the financial impact, mm-hmm. Now I'm not familiar with the Relief Supplemental Appropriation Act of 2021. Is that something currently we have in the budget, or is this separate monies, or where is this coming from?
Okay, so officially as of yesterday, we received notice from FTA that we would be getting part of the $14 billion that was a part of that package for transit. Is Bryn Dice on the call, our Chief Strategy Officer? She can probably, but the short answer to that question is that those funds were not a part of the budgeted allocations that were included. So basically, I'm going to give you the overview and I'll let Bryn come back. But we are going to have an additional $5.9 million into our budget just under the CARES Act program alone. Then there's an additional FTA program that reimburses us for expenses such as PPE and other COVID-related expenses. And though that's probably an additional $500,000 on top of the $5.9 million. And so these funds were not included in the projected revenues in our budget. And so that is why we feel like we're in a great position to be able to do this. That was one of the reasons why I held off this long in doing it, because I wanted to reevaluate come January and where we were financially so that we would make sure that when we did it, we weren't necessarily bankrupting the organization or putting us in a position of financial strain in doing it. The great thing about it is through the open communication with our union partners and with our employees, they understand that it's important to have a job for the long haul. And so we, again, have really just reiterated that we wanted to reevaluate where we were in this month, by this month, so that we could put that forward. So that was kind of a long-winded answer to that question, but I'm gonna ask Ms. Dice to kind of weigh in on those additional funds. Ms. Dice, and for the benefit of our new board members, this is our Chief Strategy Officer.
Thank you. You said it, Ms. Bacara. There are two funding sources. I think we're calling it CRRSA, CRRSAA, Coronavirus Response Relief Supplemental Appropriation Act of 2021. That was released yesterday. And again, we have more than $5.8 million allocated to us, and that will be divvied up in our 5307 funds. So we can extend our 5307 funds from a smaller percentage to 100% operating cost up to that 5.8 million. The other source that we found, the FTA extended within the last 2 or 3 weeks, they extended the emergency relief funding, and that allows for those extra supplemental things that are 100% directly related to the pandemic, to COVID-19. As a preliminary estimate, we went through all of our expenses from the beginning of the pandemic up until when they're going to cut that funding off, which is January of 2022. And we've estimated more than 500,000 additional funds that are quite frankly costs that we have spent or anticipate spending that can get reimbursed again at 100%. So we were excited to get those figures recently.
Okay, Mr. Adams, do you have anything? Director Adams?
I think my question was answered. I was wondering where the funds were coming from. I was wondering where the hazard pay funds were coming from.
He wanted to know where the hazardous pay funding was coming from. He's breaking up.
It's federal relief funds, right, Ms. Mulder?
Yes, sir. That is coming from the federal relief funds that we'll be getting from FTA.
But is that a grant? Is that considered a grant?
We put it in our TRAMS system similarly to a grant, but it's not money that we need to apply for. It's money that is apportioned to us. And so we just need to basically fill out the paperwork saying, here's the documentation to prove how we spent it.
Right.
Because on page 2, where you say grant eligibility, the answer was yes.
Well, we're eligible. I'm sorry.
That's why I was asking the question. What grant other than the relief are we talking about? We said yes to that question.
Well, there are two different funds. One is a grant and one is an apportionment. The $5.8 million is an apportionment that, based on the 5307 funds that we already get from FTA, we have been apportioned that amount. Now, the more than 500,000 that we were talking about in COVID-related expenses, that is a grant, and we do have to apply for that, along with documentation and proof of the expenses that we have incurred or that we plan to incur or feel like we will be incurring to deal with the COVID pandemic. So that one is an apportionment. The biggest fund, the biggest chunk of money is an apportionment. Like, we are eligible for that. The other one is a grant that we do have to apply for. So they both just happen to fall under that COVID umbrella. So
I want to ask one last question, I promise. So what are the plans to disperse this money? Because we're talking about money that we plan to get in the future. So when do we actually plan to be able to give this out to the eligible employees?
Well, once it is officially approved by the board, or if it is officially approved by the board at the January 26th meeting, I mean, we could possibly do it as soon as early February if the board approves.
Okay, thank you.
All right, Dr. O'Halloran.
Yeah, I was going to bring it up under new business, but since we already delved into it, can we get I had Beverly send out a fact sheet about the 5307 funds, and maybe we could have a quick discussion about how they work and the fact that we've been using that since 2015 to pay expenses and operating costs. which is how we covered our budget shortfalls over the last 7 or 8 years.
Right.
I don't know if everybody's aware, but those capital monies, once they're moved out of capital, they're no longer eligible for things like building, remodeling, purchasing buses. And this 5.9 is going to replace some of that, but we're taking approximately 3 million a year out of that account to cover our costs, which means we're basically underfunded. I don't know, I guess that would be Bren. Is that your field?
Sure, I can touch on the 5307. So you're right. 5307 funds, again, are apportioned funding source from the federal government. I'm reading straight from that sheet about eligible activities. So we can use it for planning, engineering, design, etc. But we mainly have been using it for operations and preventative maintenance to shore up our budget. On the contrary, we use our SPLOST funds, which can only be used for capital projects. We use those obviously for capital projects, but exclusively lately as matching funds in our capital projects. So, for example, the buses that Mr. Cooksey talked about purchasing, all of those, that 20% required funding, all of that comes out of our SPLOST funding. And so it's kind of a balancing act to be looking at how much money we have in SPLOST, and obviously SPLOST keeps building every time the county makes a payment to us. So we have to then plan out our long-term strategies as to when we're spending what money. Currently, we have plenty of money, to touch back on Mr. Cooksey's conversation. We have plenty of money in the SPLOST funds from SPLOST 6 to cover all the buses that are proposed right now.
Yeah, which is good. And the thing we have to recognize is once we take that out of capital funding, we no longer get a SPLOST match when we spend it. So we lose that SPLOST money because we're depleting our capital money.
Which
and
also
we have plans to expand, and we've been talking about remodeling Cat Central for 3 years, but when we took it all out for other expenses, we were unable to redo the building as we planned to, probably going back 3 years.
Right. Well, we do still have some money that was in the super grant that came in to go towards that, and we'll be doing some smaller remodeling because, again, COVID has impacted everything down to space planning. But what's even more important is the work that we are doing with Mike Vacker, with Squire Patton and Boggs in terms of the transportation SPLOST. That's what makes that important. I was down at the legislature yesterday, met with Representative Gilliard, who is actually going to be one of our House sponsors, as well as Chairman Stephens, who is also going to be one of our House sponsors. We talked to Senator Ben Watson and Senator Jackson in terms of the work that they're going to do on the transportation SPLOST. And so for the benefit of the new members, what makes the transportation SPLOST different from the T-SPLOST that you all may be aware of? The transportation SPLOST, those funds can be used for operating and for capital out the gate. And so that will open up a world of opportunities. And I remember when I first brought this to the board last year, I remember Commissioner Stone asked a question about the millage. Well, again, that's when, decisions, I guess, will have to be made about how we're going to fund transit, but at least that will be a different vehicle that will give us some options and some opportunities as we grow and expand our service so that we can provide the best service possible to those who live, work, and play in Chatham County. So I think this is an exciting time for our agency. I think that we will, from my vantage point, it looks like we have more options at our fingertips than many agencies across the country, because conversations probably aren't like this in a lot of places. And so we're in a really good place financially, and we've just got to continue to make great decisions and smart decisions to go along and support that work. But we're
probably looking at 2022 before that could actually be put through.
Yes.
And I appreciate the conversation. I think it's good that we're all now aware of how this whole funding, some of these funding streams are run through the organization. And if we can get that 3 million back, we can do a lot with that, because obviously the TAM plan and the replacement vehicles, you know, they get older every year. They don't ever get any younger, even when we maintain them. A lot like the board members, no offense. Since I think I'm the oldest one, maybe not. Thanks. Thanks again, Bren, Bakara, everybody who participated. I think that was a great conversation, and we need to have more of them to keep us all informed as to what's going on, especially with a lot of new members.
Right.
Thank you.
Vice Chairman Edminster.
Brent, something you said that I thought might be an interesting piece of information to share or to talk about is how much we are able to multiply our SPLOST funds by, which I think could be an interesting sale point for anybody who's trying to get support for SPLOST, is being able to say when SPLOST dollars are given to CAT, they're multiplied by X, because it seems to me that because we're using them as matching grants, so usually around 20, 30, 10%, if I recall, that's a lot of federal money that we wouldn't be able to get if we didn't have access to those funds. So that's not an official document request or anything like that, but it would be interesting to see, you know, we matched, I don't know, I'm just talking like $5 million of SPLOST funds got us, you know, $50 million of federal funds. That's a huge win for this community.
And I agree. I think that's a story that needs to be told. I mean, we talk about, I know I've said it in my talking points, you know, for every dollar invested in public transit that you get 4 in economic development. And I think that's how you tell that story. So
it could also be, I mean, I don't know anything about this, but I would imagine that we might be able to be multiplying money more so than almost any municipality or agency in town. You know, I don't think, you know what I mean? I think that could,
there's definitely,
it could really reverse the narrative of what CAT does financially.
I agree. We do have a challenge. We do need to tell our story. As I've always said, there are a lot of great things going on at CAT, but we have to tell a story. And that is definitely one of the stories that needs to be told about how those SPLOST funds are being leveraged to create so many millions of dollars in, you know, in impact, and use as leverage to bring so many millions of dollars of support from the federal government. I agree. I think that is a story that needs to be told, and we'll definitely.
Yeah, let's take a look. That could be fun to get those numbers.
Actually, this is a good time for that, I think, because SPLOST 7 has just been passed and is now moving forward. And so we can really have a pretty good indication of how much we've had from SPLOST 6 and how much that's multiplied.
And certainly be good to let the chamber know.
Absolutely. Mr. Chairman, so I can get to Beverly. Commissioner Adams said the meeting just went out and he dropped. Can you try to help Commissioner Adams get logged back into the meeting? I checked. I noticed he just disappeared all of a sudden, so I wanted to make sure we didn't lose him.
I've had the same problem. I keep getting dropped.
Yeah, I'll check on Commissioner Adams.
Is somebody sharing their screen?
Somebody is now.
Oh, Dr. O'Halloran, you're sharing your screen. Would you mind unsharing your screen? Okay. All right.
Looks like it might be a problem with iPads. Helen's on an iPad and Adams is on an iPad.
I'm on an iPad.
That's got to be where the problem is, because I'm on my laptop.
I'm on an iPad.
I'm not sure. I'm sorry. I'm sorry that that's happening, Commissioner Stone.
I just keep going in and out. So.
Okay. Well, I've asked Beverly to reach out to Commissioner Adams to try to help him get logged back in, because we want to make sure we have everybody on the journey with us. So she's gonna reach back into. Any other questions about the hazard pay? Okay.
Just to get clarification a little further, the fund is 2750. Am I the federal appropriations? What am I trying to say? The funds we were just talking about, the ones that we use for
5307?
307.
Yes. All right. Don't we fill out a form, or we let them know that, yes, we understand that these are supposed to be used for capital, but we would like to use them for operating, and then the FTA says, okay, that sounds great?
Chad Reese did that in 2015. We've just never revoked it. He applied for that 5 years ago.
Got it. And
We would have to tell them we're no longer going to use them, because that has to be specifically identified to FTA as to what exactly we use them for penny.
Also, in this case, with the CURSA, whatever we're calling that new fund for 5307 funds, they are strongly encouraging no capital projects in this.
I saw that.
And it's really because we don't know where we're going with the pandemic.
Right. And we don't know where we're going. We don't know how long it's going to last. We don't know if transit is going to be in the next stimulus package, and so that's why. And there's so many other agencies that are hurting in a way that's far worse than we were. Truthfully told, 5 million was my number, but 3 would have balanced everything. 3 probably would have balanced everything. 5 was a bonus, and 5.8, yeah.
And the FAST Act is coming up quickly, literally, and we will find out what we're going to be eligible for then. We have no idea how well funded that will be. I'm assuming with this new administration, it'd be a little better, but there's no guarantee of that.
Correct. And now the other good thing is that we are really, with the advent of our work with Clever Devices, we'll be able to track our ridership in a better way, in a more scientific way, if you will. The 5307 apportionment is based on ridership data. And so we'll be able to, do a better job of tracking that. We have already caught some things that will allow us to have better ridership numbers. And we've submitted that information to FTA as well. So we may even see our apportionments go up as we're doing more reporting. So, I mean, things are definitely trending well. So I think we got Commissioner Adams back. Okay. All right. All right. Good deal. We want to make sure we have everybody on the journey with us. So.
And I want to, related to our federal relief funds, as far as allocating that to the employees, I stand behind that 100%. I think that our employees, our frontline employees for sure deserve that benefit of this money. With that being said, do we have anything else, Ms. Malden, on this subject?
I think Commissioner Adams had a question. Oh, no. Okay, he's good. Nope, that's it for proposed agenda items.
Dr. Robinson.
Oh, sorry.
I just have a question about the fact sheet that we were sent. It was attached to our
yes.
We were given that for what purpose? Because I did have some questions on that, but why were we given that particularly?
Dr. O'Halloran, actually, I think that was a fact sheet that he had from his time as chair. And since we do have new board members coming online and we're throwing around jargon and acronyms, 53, 10, 11, 12, 13, 14, 15, I think that it was just an opportunity to kind of put some information in front of the board for consumption in terms of what our funding sources are. and what the limitations are of those funding sources. So it was just an educational tool that Dr. O'Halloran requested. Asked the chairman if he could add that to our board packet and agenda.
And one other clarification on that, when we invoked that use of 5307 back in 2015, it modified our procurement policy, which is what we've been evolving over the last 4 years and finally approved in 2019. Because we invoked that use of those funds, we are under strict guidance on how we procure from the FTA, and we cannot violate that, which is actually leading into our next discussion. It's much more intense and it's much more restrictive as far as procurement. We are certain policies that we may have been using in the past were wiped out. That's why it took so long to get that modified. You'll remember we've been going through that since sometime in 16. When I first got on the board, we were talking about the changes when we had the FMOs and our triennial reviews. That's why all those changes were made.
Chairman Cody, and tell me if this is not the place to ask this question, but even as I look at this fact sheet and with new board members, I do have a concern because, you know, we talk about onboarding, which I never received. And I'm thinking handing a fact sheet is great, but if there's no explanation or no real conversation for new board members, I mean, a lot of things we're talking about today puts them at a disadvantage. So at what point are we talking about onboarding and making sure that our new members are informed?
We were looking at I believe it's the second week in February. So we can get the new members. And I think Director Leggett also said that he had never gone through this process. So we have our attorney, we have Ty Butler coming on with his staff to present this to us. I think it's the second weekend Tuesday, but I will have to check with Beverly to make sure on that.
Please let us know.
All right. Do we have anything else?
That's planned for the next regular meeting schedule on the 9th.
I believe it's Tuesday, maybe what is it? Is it the 9th, Beverly?
Have the first Tuesday open or either the second Tuesday as an option.
But we're gonna make it a part of a board meeting?
No, it'd be committee meetings, the second Tuesday.
But the onboarding is going to be a part of a committee meeting?
Yeah.
The first Tuesday is open. And I'm sorry, go ahead, Ms. Malden.
Well, Mr. Chairman, may I ask a question? I guess, or more or less make a suggestion. My suggestion was actually going to be, since we have new members and we have current members that haven't gone through the onboarding, and then we have so much has changed just in the overall landscape of transit, just even in the last 365 days and beyond. I was going to suggest some type of retreat that included an orientation, because I think maybe it's time, it seems like it may be time for a recalibration of the direction that we need to go as an organization. And if you would respectfully consider, I think it would be a good time to have an orientation or an onboarding retreat that may be a full day, perhaps, maybe 2 days, whatever the board's pleasure is. But it start out with the orientation. We give historical perspective of where we started to now. And then we talk about where the agency needs to go in order to meet the needs of our customers. I would just like to throw that suggestion out, and the sooner the better. So if we could definitely, if we could do that the first week in February. I don't know if it necessarily should take the place of a committee meeting, since there is a lot of information. The committee meeting is where the work is done in terms of getting ready for the action items. So I don't know, it would take the commitment of the board to be committed to having that extra meeting. But I would like to throw that suggestion out. I think that would help. I think that would help everybody get on the same page, so that going forward, everyone will have the information, the background that they need in order to make the decisions that you all are going to be asked to make.
And definitely before we go into budget talks, because if we don't understand the whole process, kind of hard to budget.
Dr. Roberts.
And I agree with Ms. Malden. I don't think it should be a part of a meeting. It should be something separate that takes up as much time as needed. And I would even suggest, instead of a Tuesday, maybe doing it on a Wednesday, which, just find out whatever, because I think there's city council meetings, things like that I don't know, when does city council meet? Mr. Leggett? But anyway, I was thinking on the day that there was not a meeting, of any of our board members.
I like the idea of the retreat, and we can take care of everything at one time. That it will give us a lot more time to actually identify what our responsibilities are.
Yeah, Thursday and Friday are the commission and city council meetings. So Monday through Wednesday are generally open for CAT stuff.
Well, we will be happy to do whatever, Mr. Chairman, you want us to do to support moving that along.
What we'll do is we'll get everybody's information. I want to touch with everybody one-on-one to make sure everybody's available the same time. And once we confirm that this week, then we'll go ahead and send it out.
Thank you, Mr. Chairman.
Thank you. We have anything else? All right, going into old business.
Okay.
Moving on to old business, legal services RFP as a discussion item. I believe Ms. Malden wanted to share some information with us. So
Okay, thank you, Mr. Chairman. And I think Dr. O'Halloran gave us, I guess, a perfect segue into the discussion points for this item. Just a bit of historical perspective for our board members that are just joining us. We issued an RFP last year for the procurement of legal services pursuant to the requirements that we're subject to because we do get this federal funding. We issued an RFP. The process, went through the RFP process. The staff made a recommendation and the board took action. The action that the board took was they took action. And so now the #1 ranked entity filed a protest, and pursuant to the procurement policy that the board passed in March, which, as an aside, was before I even got here as the CEO. When a entity files a protest on the board's decision, it goes to me to adjudicate, which, as you understand, that puts me in a little bit of an interesting position. But in light of that, I think that there are many, many, many valid points that I heard throughout the deliberation of this whole thing. And I actually wanted to bring up an idea for the board's consideration. I would like to move forward with the FTA procurement based on the staff recommendation, but I would also like to move forward with retaining our current legal counsel as the board attorney. And as the board attorney, he would continue to advise the board on their day-to-day decisions that the board makes as a body and individually. It would allow us to still have the historical perspective that is greatly needed, because in order to move forward, you have to understand where you came from, of course. And so the historical value that he brings. But then also going through with the procurement process will allow us to move forward on some very, very important FTA work that we need to frankly pursue, that basically deals with the lifeline of a lot of these FTA projects that we're working on. We've also been the recipient of a lot of FTA CARES Act funding, and with that money, it's great, but there are regulations that go along with that and requirements that go along with that. Now, the good thing about moving forward with the two attorneys is that we have the ability to carve the funds out locally to pay the board attorney. However, for the agency counsel, which would be that contract would be awarded to that entity, that fund is actually eligible, or that work is eligible for reimbursement from FTA. That entity is also on our insurance provider list, and would be eligible to handle all of our insurance work, which would also render them eligible to have those costs paid for by insurance. So we would basically get the benefit of having both attorneys. We would get the benefit of the industry knowledge, the historical perspective, and all of that with minimal impact to our budget. And so it's something that I'm respectfully requesting the board to consider, as we go through that deliberation. Dr. O'Halloran.
Yeah, I have one question. I know we received the 4 bids, and we talked about not redoing the RFP, but won't there be changes in the billing, particularly the retainer fee that the legal firms would charge us if we're only giving them half the services?
Well,
and how would the suit with Miss Roundtree be handled? Who would do those?
Well, the suit with Miss Roundtree, I'm sorry, first of all,
I know it's kind of borderline. I'm not sorry.
I wasn't supposed to say that name. So, okay, litigation would be handled by more than likely the agency attorney, because the insurance pays the cost of that litigation. So, and with the agency attorney being on the insurance, on the Chubb, we call it the Chubbs list, those cases would be able to be assigned to that attorney. So in that particular instance, that case would be assigned to that attorney to handle. However, that attorney, because the attorney is working with me and I report to you all have access to that attorney too, just like you all would have access to Ty Butler. And so we would still continue to be transparent. In fact, I think this would be more transparent, because with the attorney of record on the insurance cases already being directly procured or directly contracted with our agency, we would be able to get a quicker response to inquiries. I know there's been a lot to be desired with the way that it's currently going with other outside attorneys handling those cases. We haven't been able to get information and responses as fast, but with the ability to have those, have that be kind of in-house, so to speak, or with an attorney we're contracted with, we'll be able to better manage those cases and that litigation process as well. So I think that if the board would be open to considering that, it would really give the agency the benefit of, in the best of both worlds, where we would be able to continue to work with Mr. Butler and his firm, and then we would also be able to have an attorney that is procured through the FTA process to help us move forward with the FTA work, to help us move forward with the insurance work, so that we can do a better job of managing all of those things on every front.
And Dr. Rob.
Director O'Halloran made a statement that I wasn't clear on. He said there was discussion about not redoing the RFP. We had that discussion. Is that what I understood you to say?
Oh, you're on mute, Dr.
I
Halloran.
went the wrong way. My comment was when the original RFP went out, it included all services, including the board.
Mhm.
When Jackson Lewis responded to that, they included all of that work in their $96,000 retainer fee. So I don't know if that needs to be modified or whether we would have to resend that as a separate RFP for strictly those particular parts and use them as a contractor in the meantime to satisfy the FTA requirements.
I'm gonna ask
I'm not sure where we would be with that. I think we have to give everybody the opportunity to readjust their amount based on the new scope for just what we're referring as the House Counsel.
Mhm.
That I'm not a lawyer. I don't know. Maybe David has some idea on that since he's got some legal knowledge over there.
I'm gonna ask David to
I see him.
explain.
He's up.
Okay.
Well, I have a question too, real quick.
Yeah, but before we move forward, I guess what my question is, are we talking about redoing the RFP, sending it out again since we was talking about splitting it? So would you not split both? Would you not do an RFP for both, or would you just automatically use TIE for the board? I'm not clear on what we're talking. I'm not clear on what we're talking about. And the other thing is that if, when people quote, they quote in a given year,
Right.
like quoted 2020. Well, 2020, even if we have it, what if his cost goes up as a result of just it's a different year? So how would we make sure we had all those pieces in place and we knew exactly what we were getting?
Well, two things. One, my suggestion is that the board just outright hire Ty Butler as the board attorney with no RFP. And as long as it is our understanding from FTA that as long as federal funds are not used to pay his legal fees, that the board can do that. You can outright hire Mr. Butler as the board attorney to just work on board matters. You can do that outright with local funds. Where the issue is with the RFP is because we have FTA projects and we have insurance projects. I keep adding the insurance in there, but the main thing is FTA projects that require work for the vendor to be, procured through the FTA procurement process. That's the reason why we were doing the RFP in the first place, was so that we would be in compliance going forward for our FTA projects. And that's really important because as we continue to leverage more and more funding, we're going to be more and more on the radar. So we want to make sure that we're doing it according to the compliance rules. It was also my understanding, but I'm going to ask Mr. Stearns to confirm, but I always thought you could ask a vendor to do less, but you can't ask a vendor to do more. And so if we're asking the vendor to do less, it was my understanding that we may not necessarily have to redo the RFP. And to be quite honest, we have projects that are on hold that we really, 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 really need our attention on the legal side that we've just kind of had in a holding pattern. And so the quickest route to right is what we would respectfully request on the staff side because we are in a holding pattern.
I have a couple of questions.
Can I get Mr. Stearns to answer this question first? And please.
I just want to make sure y'all can hear me. Can anybody hear me?
Yes, I hear you.
Oh, okay.
So I just want to make sure I understand the question and then I can try to answer it. So is the question, can we move forward with the contract as is, but have the recommended firm do less work? I think the issue is more like it ties into, okay, how much they bid for it and what the scope of what they're doing. The scope of the RFP is such that it's broad enough that they could, you could have the recommended vendor do or not do a number of things, because the scope is pretty broad. You and terms like, you know, be at the request of the board, they still would be. That's still a thing. So that aspect of, you could keep the scope the same, and that the scope being the same is what really is probably the determinative of whether or not you would have to go out to reissue the RFP. If the scope is staying the same, you're not making a material change, then you're all right. Now, the bigger question is, okay, if we keep the scope the same, we can have one firm do this and one firm do this, but how do we do the payment issue? And I think that's where it's a little bit dicey, in that I may not have an answer right now. If we were to keep the payment the same and the scope the same, and say, hey, you firm that won this contract with this scope and the payment you said would work, then you have no problem. And you can still go out separately, because all of our contracts they're not exclusive. In that CAT can always go out and get another one, as far as another vendor that does the same thing. There's no exclusivity clause in our contract. The problem will be is if you're going to depart from this scope for this price with this firm, that's where you may have a problem. Now, you could keep this scope with this price with this firm and have another attorney for the board. And as Ms. Malden pointed out, when you're using truly local funds, as in not FTA funded, and you do a good job of making them separate, you don't have to follow FTA procurement. Technically, you have to follow our own procurement guidelines, so we may want to take a look at that, but you can, it's very different. Now, that being said, I think that there's enough work out there for, I think what Ms. Malden, and correct me if I'm wrong, was getting at is, we could keep the scope the same and the fee arrangement proposal the same, and keep the attorney that was recommended for the contract busy enough with a large percentage of FTA funded projects that it would be justifiable. And maybe that's what Ms. Bakar was saying, was that if you keep the scope the same and you keep the fee the same, we have enough work to justify doing that. And if you do that, then I would say, oh, then you're good. You don't have to worry about any sort of change in scope and put in the RFP back out or anything like that. I think where you run into a problem is changing the scope or changing the proposal terms that were submitted. If that's somewhat of a dance around issue, but I don't know if that gives you a little more insight into kind of this area.
Well, my real concern is just over the retainer fee, because if they're doing less work, wouldn't that go down?
Okay, say that again.
The retainer fee, the upfront payment, won't that go down if we've narrowed the amount of work they're doing? I mean, that was based on how much work we asked them to do, and we would be billed over and above that at an hourly rate of $3.15.
Well, there's a lot of work on the staff side, though. So I mean,
well, I understand that, but when they bid it, it was to do all the board work too, and I assume that went into the cost of the retainer. So we're talking about, you know, are they going to hit 96,000, which is like 300 hours worth of work? I don't know. I know if I were making a bid for something and I asked for a retainer, it would be based on what I was asked to supply. And if I got asked to supply 60% of that, then my retainer should drop precipitously by 60%. Because we're going to have to pay them up front that 96,000. We may not recoup that for 9 months.
Is there a way, Mr. Stearns, to go back and give all the proposers an opportunity to resubmit there? Because we have 2 weeks before our board meeting, in fact. So is there a way to go back?
there's a way, but then you essentially run into the effort of reopening the RFP. So once proposals are submitted, you have to reopen the RFP. If you're going to at all change the evaluation criteria or any sort of scope, then you kind of reopen the RFP. So I think if you're going to mess with I hate to say mess with, but if you're going to change either the scope of what they can do, and as Ms. Malden pointed out, you can always do less, but like if you said, oh, and include this, or you're going to do that, that's where you run into a contractual issue, because you just make scopes broad that say could include, boom, and you put it out there.
And bear in mind that retainer would be part of the reimbursable FTA. that would be an FTA reimbursable expense. So
yeah, so if they're working on purely FTA projects, that amount of time could be reimbursable because we've properly secured the contract. So the issue is there will be for a staff attorney stuff that isn't necessarily reimbursable. And that's where, I don't know, you know what I mean? I think from my perspective, there's a lot out there that's FTA projects, especially in marine right now.
and think about it, technically COVID is an FTA project right now. I mean, that's
marine, I'm comfortable saying, oh yeah, that's very clear and refundable and all that. That one's easy. There's likely potentially others out there and stuff like that.
But I think that there's a significant amount of work for both attorneys to do.
I get it.
I'd say that's fair.
Like I said, if that we think we're going to meet that threshold, then I'm fine. I just don't know if they'd want to redo it, but if it eliminates confusion, let's go with it. We can always look at it in the future.
And go ahead, I'm sorry.
Well, this is something that would come up to it's not a vote, but it's an agreement, right?
Right, because right now, as it stands, the protest was filed and I'm the adjudicator of the protest. However, I have said since day zero of my tenure here that it's important that we all work together. And unfortunately, because the rules do make me the final adjudicator, I would not want to make a decision that my bosses, that the board or my bosses would not be pleased with.
Okay.
And I think that it would be prudent to kind of come to a middle ground or an agreeable road so that we could all move forward with this together, because we have so much stuff we got to move forward with. And so I would just really hate for us to be in a holding pattern over this.
Well, why don't we put it in as an action item for the next board meeting so we can finish the vote?
May I speak, please?
Yes, Director Stone.
Thank you. I would like a summary of this before we vote on this, as to where we are with all of it. And my concern is paying to law firms. I'm not sure it's necessary. So if we could just, before a vote is taken, I would like a written summary of everything.
Absolutely. We will get that to you.
Thank you.
And I want clarity on what Mr. Stern was saying. So are you saying that we're not changing the scope of the RFP? Because to me, it sounds like we are.
That's what it sounds like.
So I want to make sure.
I wasn't saying we are or we aren't. I'm saying you don't have to redo the RFP if you don't. And so in my mind, you could hire Jackson Lewis under our RFP, under the scope with the agreed upon proposal, and still hire whoever the board wants. So I'm not necessarily saying we are or we aren't. That's a decision for the board. I was just trying to stay that you could award this contract to one vendor and still, without any sort of violation of the contract or FTA kind of guidelines, hire someone else to do the same or similar work depending upon what the board wanted and not violate the RFP or the contract. If that, does that clarify any?
Well,
So my
then it goes
suggestion,
back to what Director Stone just asked. It appears that we're hiring 2 attorneys to do the same work.
Yes.
So if we're not changing the scope,
no, we're
if
not.
we're not changing the scope, and I think it goes back to Dr. O'Halloran's first comment. If we're not changing the scope, we're saying to 2 legal firms that we want to hire you to do work for Chatham Area Transit. And what we're saying to one attorney is, you're going to focus specifically on board issues.
Mhm.
We're saying to the other attorney, based on the scope that you originally bid it for, you're going to be doing both.
No.
What
No.
Hear me, make sure I'm clear.
Okay.
If we're not changing the scope, if we're not changing the scope of the first RFP, we're saying to one attorney that you're going to do FTE work, and you're going to do board work. If we're not changing the scope.
No, what we're saying is that, first of all, let me back all the way up. It is not unusual for a transit agency to have more than one attorney. Let's start there.
Yeah.
Okay. All right, that's point 1. Point 2 is that, again, you can always ask in any entity that you contract with. For instance, let's go back to if you hire an accountant, you may have 20 things listed in the scope of what that accountant could do, okay? You may only have that accountant doing 7 things out of the 20 things that were in the contract, but that doesn't mean that you violated the contract. So you can always ask them to do less. And also, because I report directly to the board, I would think, would still want to be able to have access and seek the counsel, if necessary, of any attorney that Chatham Area Transit hires. The other attorney would be specifically for the use and advice of the board. The other one would be for the oversight of the FTA projects, the insurance claims, and all of that FTA covered work. So you can have 2 vendors that have overlapping scopes of work, but again, you can't ask them to do more than what you've contracted them to do, but you can always ask them to do less. That goes with, like, for a job description. That's just like with an employee. You may have 35 things that you ask an employee to do theoretically, but they may only touch 5 of those. So you can always contract, have an overarching agreement that says you can do A, B, C, and D all the way to Z, but their primary focus is in a certain discipline, certain area, or however the board dictates that it should be. So does that make sense? Dr. Robinson? Chairman Cody, I know you kind of shook your head a little bit.
Well, again, I understand. I'm clear on everything you're saying. But again, I know you cannot ask them to do less. I mean, more, but you can have to do less. But the scope of it appears we're changing the scope, and we're hiring 2 attorneys when we can almost use 1 attorney to do everything. And that's what I'm still not clear on.
Well, and the reason why I proposed the board attorney is because the board made it very clear that they wanted to continue to utilize Mr. Butler because of his historical perspective, the work that he's done with the agency over the years. And so the board some members of the board made it very clear that they want to continue to utilize him. But Mr. Butler was not the winner of the RFP. And so in order to be able to utilize the FTA funds to cover that work, to get them to work on the FTA approved projects, you have to go through the procurement process and have the winner of the procurement process, basically serve as the counsel for those projects. So my suggestion to the board was an attempt to kind of incorporate the best of both worlds, where we're still able to utilize the services of the attorney that many of the board members expressed they wanted to continue to have the advice of, the counsel of, but still keep us in the clear with FTA as we move forward on these projects, and keep us from having, because whether you all know it or not, even on these insurance claims and things like that, our insurance folks are going out hiring other attorneys to represent us on insurance claims because the counsel wasn't on the approved list by the insurance agency. So now by having both of these attorneys and one of them already being on the insurance list, going through the FTA process, it checks both boxes. So I was just trying to put it out there as an attempt to kind of marry everyone's thought process, check the boxes that are required to be checked so that we could all move forward with the projects that we need to really, really give some attention to.
Right. I believe I agree with Director Stone. We're gonna need to get something in writing.
Okay.
We have, as a board, we've already voted on this, and we awarded Bowman and Pelican the contract agreement. So I think that we need to move forward with the contract for them, and then we can take this into consideration once we got the paperwork needed for us to follow up on a lot of this, because I, for one, I would like to know what's our responsibilities to the FTA that we already pay a certain fee a year for them to assist us in moves of this nature. So,
okay. So we have a protest that has to be responded to. And based on the procurement rules that the board approved, I actually am the adjudicator on the protest.
Have we gotten a written response to the protest?
No, I have not responded to the protest yet.
All right,
I have not responded to the but in all honesty, I think that response is due tomorrow.
I think that we would need that response, and we're gonna definitely need to get this in writing so we can all take a look at this, because to me it seems as though we are walking up a slippery slope with the RFP. May change, it may not.
We are recommending that the RFP not change.
Right.
And we can't vote on this, so Bakari, you're gonna have to tell us what you're gonna, where you're going with it, because we can't change that now without having a board meeting. We're not eligible to vote during this committee, so if you have to do it by tomorrow, what's your answer?
I wanted to have this discussion with the board. And honestly, we didn't follow our policy. Bottom line, we did not follow the procurement policy. It's a tough position for me to be in because y'all hired me, but we didn't follow our procurement policy. And that's the issue. Vice Chairman Edminster, you were waving at me. So
I just, I just to echo what Ms. Malden said, I mean, we're here in this position because we didn't do what we had been talking about and rehashing multiple times over. And I've got to give our CEO credit, I think, for threading the needle through a fairly complex procurement agreement. And I think coming up with the solution that, I almost hate to say this, is better than what I think we were provided with just the RFP. I think this is a really elegant solution. And I think it'll be extremely helpful. It'll give the staff the support of a pretty incredible legal force behind them that's very current with FTA regulations, as well as give us the tradition and the history that Ty brings with him. And we also get the benefit and the full force of Jackson Lewis. I really think that's this could be a win-win-win situation for us and checks all the boxes. From what I've heard today from Ms. Malden and David is I feel quite confident in their ability to navigate the RFP process, both at an FTA level and locally. I don't really see any concern there. I definitely do agree, though, with Helen and Director Cody that we should have some sort of written statement of what's going on. I think that'll be very helpful for us, even just a summary of what you have to decide to do tomorrow. And I think this could be a win-win-win situation for all of us, because we get Ty, we get Jackson Lewis, we get legal services, and we get them refunded by the FTA. That sounds great. I'm all here for it.
I just feel like communication is just. I promised when you were hired to be an open communicator, and so I think to make a decision of any kind, which is what I'm faced with having to do based on our policy, on CAT's policy, in terms of protests. I just think to do so without engaging the board at any level would be non-transparent. And so we were just trying to be transparent about where we are in the process. And so thank you all for your indulgence in the conversation.
Thank you.
Because it puts the CEO in a very awkward position, as the final adjudicator. And so I just want to make sure that I want to make sure that you all understand the position that I'm in, right. and that you understand what, where we are going forward and how we're proposing to come out of this.
So how are we going to respond is really my question now.
We have awarded a contract about 2 months ago, and they haven't received the contract. So I think that we need to expedite that.
There was a protest.
All right.
There was a protest, and according to CAT's procurement policy, Chatham Area Transit's procurement policy, when that protest was filed, it goes on my desk to make the final determination as far as the award of the contract. And that's not something that I made up. That's in the policy.
I'm just wondering since it has to be tomorrow and we can't vote before then, what are we going to respond to the FTA? That's what we need.
We should have received information on this.
Helen, you're breaking up.
We're faced with this.
My response is not to the FTA. My response is actually to you all and to the respondent that protested, the protester.
I'm sorry. I'm just saying that it would have been helpful to have had some information.
Well, I will take the L for that. I was ill last month. I was a little out of commission. So I had not even started looking at the facts until after the first of the year. So I wouldn't have had anything to present to the board until after the first of the year, because honestly, that's when I started looking at it. So unfortunately, I'm not in a position to have given you all any information.
So basically, we're going to say that, yes, we're going to give the contract to Jackson Lewis for all FTA related CAT organizational legal fees, and then we would have to have a separate contract for Ty for the board.
Yes.
So you're going to respond that we agree with the protest, and we're going to issue the contract to them for the services that we requested.
And then I would like the board.
One shouldn't have anything to do with another, right? If we already awarded Ty the contract, shouldn't we just be going towards the fact that if we want to use them as FTA support?
You gotta protest against what we did, and that's what she's trying to. We got to deal with that. If you decide to do anything different, you got to deal with the protest. You got to.
Gotcha.
And then we can tie a contract after the protest is answered.
Correct. But I
We'll
want it
have
to be,
details for the board meeting that
No,
we
we
can go.
need to vote on it.
no, you actually don't. Based on the CAT procurement policy, you don't. The way that you all wrote the way that you all approved, the policy that you all approved makes me the final adjudicator for this process. That's what I want to, that's why I'm bringing this to you, because it puts me in a very, very, very awkward position. So I want everyone on this Zoom to be clear that the policy that the board put in place 2 months before I became the CEO of Chatham Area Transit makes me the final adjudicator of this process. So there is no board vote. But I recognize, and I heard the concerns that the board had, I heard the desires of the board. So I am bringing to the table the option of, if we go back and follow the process and we award the contract to Jackson Lewis, I'm asking the board to award a board attorney contract to Ty Butler and his firm. That is what I'm asking.
Ms. Bakar.
Yes, ma'am.
I think what board members need to remember is when we first went into this discussion and we had the staff recommendation on the table, the process that we used was incorrect.
Correct.
We have the right to disagree with the staff request, but we didn't handle the process correctly.
Correct.
That's why we're facing what we're facing now with the petition that now sits on our CEO's desk. So we negated our own process by doing what we did. We need to be clear about that.
No, the board did have the right to reject the staff recommendation of Jackson Lewis and take either reissue an RFP or become the self-evaluators of the process. What we did was not illegal. It did not violate the procurement. It was well within the right of the board to do what we did. Unfortunately, it was protested. If the company who didn't get the contract did not protest, we wouldn't even be having this discussion.
Dr. O'Halloran, what we needed, if you can recall, we talked about subsection S as what the board has the power to do when it comes to RFPs and staff recommendation. We went through that because I brought it up.
And we still have the right to reject it.
All I'm saying to us as board members, that we've got to be clear on process. And we have to follow our own processes. We've got to do that. And whenever we veer from that, we face what we're facing now. So
I'm not going to argue it. What we did was legitimate. Any attorney will tell you that. We have to have Bakara send the thing out. We're beating a dead horse at this point. And I have some place to be, so I'm.
What CEO Bakara is offering to us is a way to make everything work.
And we said, we're all good with it, but we cannot vote on it. This is a non-voting meeting. And she must respond by tomorrow. And if she's going to respond that way, then that's where we are. If we can't change, the response has to be in tomorrow. And I'm fine with the way she's doing it, but since we can't vote, we can't have a consensus.
We did.
Just to get understanding, the vote is not about the decision we made. The vote is because the protest is because they didn't get the contract. What is the protest?
The protest is that we did not follow. Well, wait a minute. Let me let Mr. Stearns.
So the issue is the board can do two things when staff brings a recommendation. They can reject it, or they can reevaluate it using the same criteria that we used. The board did not use our criteria. So our criteria has specific scoring mechanisms. So in order to evaluate using our same criteria, the board would have to do essentially an evaluation like the committee does. So the problem is by rejecting the recommendation and automatically awarding to the fourth place responder, the board didn't follow our own procurement rules. So the protest says not only did you not follow FTA rules, which requires written evaluation criteria that's followed, you did not follow your own procurement rules, which is true because we base our rules off the FTA. So what Ms. Malden's saying is it puts her in a tight spot because the protest says you didn't follow FTA rules and you didn't follow your own rules. And that's true, we didn't. You
I
can
disagree.
always, the board.
I disagree.
Yeah, we didn't use FTA
You can
funds.
always the board can always reject. You could have said, we reject this, and it would have just gone away. You can award to another vendor, but you have to follow our evaluation process. So you could have said, you know what, we reject your recommendation and we're going to evaluate the vendors ourselves. And that would have been perfectly fine. What you can't do is say, well, you can do it, but it violates our rules. Is we reject your recommendation and we're awarding it to this person because we want to. And that's the problem. So make no mistake, you can always reject a staff recommendation, and you can even evaluate yourselves. Like, you can become the evaluation team. I don't know if anyone's pointed this out to you, but I researched it, and the board can be the evaluation team. So no mistake, no one is saying that you can't run this, you can't reject a recommendation, nor are we saying you can't recommend somebody else. The caveat, the small caveat is you have to make the recommendation based on the criteria that was in the RFP using the process that we use.
Yes.
And that's the small caveat that makes a very big difference in this case. And so what Ms. Molden is saying is, because the way the board meeting went was we reject this recommendation and we're awarding to this person without doing the evaluation process, it puts her in a very kind of tight spot, because the protest says you didn't follow your own procurement rules or the FTA rules. And I'll say FTA and our procurement rules actually read, they're identical. So what's in our rules is what the FTA follows. So we do that for a number of reasons. But
right, that's water under the bridge now.
Right. So what's you're facing here is,
let's move on.
Right. I just want everyone to be clear. So the issue is, now that there's a protest that says you didn't follow your own rules and the FTA rules, our protest procedures say Ms. Malden makes the final decision as to what happens with that contract, and that's where we're at.
But this is only for federal funds used?
No, it's for everything, because we're dealing with our own
agency use.
These are our own rules. So we have to follow our own rules. So we could have a non-federal thing. We still have to follow the CAT procurement rules. And in those rules, a protest says, if there's a protest, the CEO will be the final adjudicator. Now, that's all combined with the FTA requires that we have rules. So we have rules, and that's what the rules that the board approved in like May, I think, or April. So that's kind of where we're all at with this.
All right. How long is it going to take us to get this in writing so we can get this out to the board members, so each board member can go over this?
I'll have my response tomorrow.
Thank you.
Thanks, David.
You're welcome.
We have anything else? All right, moving on. We got our committee assignment. Yes. Ms. Stone.
Rules.
Director Stone.
All right.
You have something?
No, I'm good.
All right. We're going into our committee assignments. Before going into the committee assignments, Ms. Malden wanted to share some good news on the new FTA funding that will soon be dispersed through public transit. CAT is looking forward to receiving some of those funds in the near future. Ms. Malden, would you like to at this time go into allocation for CAT and on the budget impact in detail?
Well, we really have already gone over a lot of that information the board already knows about the 5.8 and some change million, plus the more than $500,000 in reimbursable expenses. So there's no real need to go through it in a lot of detail, but I will make the statement that these funds shore up our 2021 budget. There is no longer a need to amend the budget, and I will be directing the staff to move forward into budget preparation, into a budget preparation posture, so that we can begin work on our 21-22 budget. So again, we are not amending this year's budget. We are expected to meet or even trend. We're trending right now below budget, but these allocations will shore up our receipts so that we do not have to amend our budget for this year. It's not party time, but it's good news.
Gotcha. All right. All right. Going back to the committee assignments, I spoke with Vice Chair Edmister. He has agreed that he would like to continue serving on the External Stakeholders Committee. So he will remain there serving as the committee chair along with Director Lakakis. I asked that Commissioner Lockett serve on the committee during this time. I also talked to Dr. O'Halloran, which he would like to move to Strategic Operational Planning Committee, serving as committee chair alongside Commissioner Stone. Our new members, Commissioner Adams, I ask that you serve on the Performance Monitoring Committee with Alderman Leggett, who will continue to serve as committee chair alongside with Dr. Robertson. As chair, I will continue to serve as committee chair for the Governance Committee along with the other 3 committee chairs. Although we are assigned to specific committees, I encourage that everyone and each of you participate in any committee meetings and discussions. That'll make you well-rounded as a board member, so you can see what each phase does at any given time. And Commissioner Lockett and Commissioner Adams, staff and I will be in contact with you, getting you all caught up. The good news is we're just getting started into the heavy lifting. So your arrival time is perfect. If we don't have anything else, I'd like to inform everybody that we have a committee meeting on the 26th, our regular board meeting, and the next schedule is actually on the 19th for governance committee meeting. So,
Chairman Cody,
yeah.
So I just want to make sure Dr. O'Halloran is the chair of the Strategic Planning Committee?
Yes.
And that goes into effect immediately?
Yes.
Okay. And Commissioner Lockett is on external stakeholders?
He's on external.
And Commissioner Adams is on performance monitoring and audit?
Yes.
Okay. Thank you. I'm sorry.
All right, no problem.
Mr. Chairman?
Yes.
My question, I'm not sure if they're doing any Martin Luther King Jr. observance days on the 19th. That's a Monday or Tuesday?
Tuesday.
That's a Tuesday. Okay, so I'm not sure what day the observance day is. I believe it may be on the 18th, but I just want to make sure our dates were connected.
All right.
It wasn't going to overlap into any observance day committees, but are we doing anything with security to make sure that the Cat Central is going to be secure, especially with what's going on with the inauguration and what's happening in Washington at this point?
Yes, we are. Actually, I see that our Chief Safety Officer, Charles Hall, is actually on camera now, but we are doing an extensive security workup because of those activities. And we're even looking at new security because our current security offerings have been very limited. And because of the times that we live in, we believe that we may need to step it up a notch. And so I'll ask the Chief Safety Officer briefly to kind of give an overview over what we're doing to secure our facilities during this time.
Good afternoon, everyone. As indicated, we are making plans for the upcoming days. I've been kind of studying the trends in terms of the expectations, and some potential civil unrest may begin as early as this Friday, and it's supposed to go for about 10 days. I know you were specific in what you asked for, but I have more of a comprehensive plan. I've already alerted to the security provider that may be asking for additional shifts to be covered. We're going to go with the same security protocols that we've had in place for the elections that we've recently had. So we're going to look at moving towards those same types of protocols moving forward. I'm continually monitoring intelligence that I'm able to get from external usage and from law enforcement. Right now, I'm quite sure everyone's heard that they're planning on 50 protests in all 50 states at Capitol buildings. There is some indication that that could actually filter down to local levels and it could impact our services. But again, I'm still monitoring information that I'm able to glean from law enforcement. That's it.
Any questions? Thank you, Mr. Hall. Any questions? All right.
Cool. Let's get that orientation and stuff done so we can get moving forward.
All right. All right, with no further business, I'd like to adjourn this meeting. Thank you all.
Thank
Bye.
you.
Thank you.
Bye, everybody.
All right.